Thanks for clicking on this orientation video. We just wanted to give you a little bit of orientation to a unique feature of our applicant process at the UCSF Family and Community Medicine Residency Program at San Francisco General Hospital. Specifically, we will be having you interview with patients, and that's not something that you probably experience a lot on the interview trail. We've heard from previous applicants that it was nice to have a little bit of orientation to that process so that you can feel more settled when you come into your interview day. And so our three goals with this video are: one, to provide that orientation so you have some sense of what patient interviews are about; two, answer some frequently asked questions that we often hear when we talk about this; and three, fundamentally to help you feel more prepared on interview day. So first, I want to give you a little bit of information about the patients who are involved in interviewing applicants. So at the Family Health Center, we have two patient advisory councils: an English-speaking patient advisory council, or PAC, and a Spanish-speaking PAC. Each PAC has 6 to 8 active members at any given time and meets monthly. There are lots of different things that the PACs do. They're often involved in quality improvement work at the Family Health Center. Sometimes they initiate their own project. Sometimes they work with us to hone other projects that we're doing at the Family Health Center. We try to provide QI training and support the PACs in really honing in on the things that are of relevance and importance to them. They do receive compensation for the time that they spend, and their mission fundamentally is to improve the care of patients at the Family Health Center. Now, some years ago, we began to talk with the PAC. It's probably been 5 or 6 years that we've been talking with the PAC about the basic problem that while patients are most impacted by who becomes a doctor at the Family Health Center, and therefore who we select as a resident at the Family Health Center, while they're most impacted by that, they historically have been totally voiceless in the process of choosing who their doctors are going to be at the Family Health Center. And so years ago, we began having them meet with groups of applicants. About 3 years ago, we began having PAC members interview applicants. So 3 years ago, about 30% of applicants got a chance to meet with a patient and do an interview with the patient. Last year, every applicant interviewed with a patient. A few applicants interviewed with staff members like medical assistants or nurses in the clinic because we didn't have quite enough patients to fill all the slots. You may see some of that again this year. But the structure last year was that patients were paired with a faculty member, and together the patient and the faculty member would interview an applicant. So it was a paired interview. That was a really good experience. We got good feedback about it. We surveyed applicants, patients, faculty members, and residents about this process. And the feedback that we got was that overall people were happy with it, but there was a lot of interest in what it would be like if patients were interviewing applicants on their own. And so after a couple of decision-making meetings with our patient advisory councils, where we engaged in sort of consensus or near consensus democratic process, the PACs advised that we will have patients do one-on-one interviews with applicants. So this year, you will be interviewing with a faculty member one-on-one, a resident one-on-one, and a patient one-on-one. And this is going to be the first year that we've had that interview structure. So to give you some sense of what your interview day will look like, prior to your interview day, the patient who's interviewing you will receive your personal statement and your CV, and they'll have a chance to look that over. They've also been trained and briefed on ACG guidelines, bias and how it shows up in interviews, how to mitigate that, and what kinds of questions are allowable and not allowable in the interview space. We've also done some mock interviews this year where patients have been practicing interviews with current residents and getting feedback about that. So we've tried to really support patients in feeling ready and being ready to engage in interviews with you all. On interview day, you will, as I said before, be interviewing 3 times, once with a patient, once with a faculty member, once with a resident. Each interview will be 30 minutes long by Zoom, and you'll have a 20-minute break in between. After your interviews, everyone who interviews you will complete a standardized evaluation or feedback form. And then our selection committee, which consists of residents, faculty, staff, and patients, will review your file as well as the feedback from your interview. And every member of that selection committee has an equal vote in how we put together our rank list. So patients are involved at that step as well. Some of the questions that we often hear when we're talking about this, one is, and importantly, are patients compensated for their time? And the answer is yes, we compensate patients for their participation in interviews and in selection committee at an hourly rate that's recommended for community engagement consultant work. Another question we often get, which patient advisors are picked to do interviews? We open it up to everyone on the Patient Advisory Council. So everyone who's on the Patient Advisory Council has been receiving care at the Family Health Center for many years and has been really engaged in the clinic. And so if they're available on an interview day, they are allowed to conduct interviews. A note about Spanish language access. So half of our patients at the Family Health Center speak Spanish primarily. Our Spanish language PAC is a really important group of partners in helping us ensure that we're improving the quality of care that we provide to people who have limited English proficiency and speak Spanish. So Spanish PAC members will be interviewing you. And so if you are interviewing with somebody who speaks Spanish primarily, we will have an interpreter available during the interview to support that interview. The selection committee is aware of which interviews had an interpreter and which ones didn't, and is aware that that is a different interview experience. And so that's taken into consideration as we look at the feedback and evaluation for those interviews. But we think giving you the opportunity to interview with as diverse a group of patients as possible is important. We also think it's really important that we give as diverse a group of patients as possible an opportunity to weigh in on the selection process. And so we do work hard to make sure we have at least that language access, with the intention of expanding language access in the future beyond just the Spanish. So I think that sums up our orientation. I mean, we are really excited to see you. We hope that meeting with patients will give you a better understanding of our program and our clinic and the community that we are part of here. If you have any questions about any of this, please do reach out to us. We are eager to hear from you, see you, and spend some time with you on interview day. Thanks.